Hello everybody, it's Dr. Corey King from AskDrKing.com, and in today's 5-Minute Friday video, we're going to talk about digestive health, and it all begins in the stomach. Are you ready? Put that timer on the clock. Let's go ahead and jump into it. Many of you follow along with myself on social media and you watch these videos because maybe you're struggling with a chronic health condition. If we think about where 80% of our immune system is located, most of you by now know that it's located within your gastrointestinal tract. Now, in order for your immune system to become weakened, we've got this GI system that's not working very well. And one thing that I've been seeing on a lot of our autoimmune patients, especially our Hashimoto's patients and our IBS, our celiac, and our Crohn's disease patients, is they have parietal cell antibodies. Now, what does that mean? Your parietal cells are these little cells inside of your stomach that release hydrochloric acid. Hydrochloric acid's job is to break down the food as it comes into your stomach so then you can move it on to the rest of your intestinal tract so you can absorb all your vitamins and minerals and you can excrete waste products the way that you're supposed to. Hydrochloric acid's job is to also kill off any bacteria, any parasites that may be coming in from a food source or from a water source. Now, if you have parietal cell antibodies, what that means is your body is attacking the parietal cells. Now, why is that important? If your stomach can't produce enough hydrochloric acid, you can't break down your foods properly, you're going to get undigested food pushed down into your intestinal tract that's going to create inflammation, and that inflammation is going to start to break down your gastrointestinal lining. That can cause leaky gut syndrome, IBS, it can contribute to celiac, Crohn's disease. Maybe you're a patient that is always fighting chronic GI infections, H. pylori, parasitic infections, candidal infections. If your stomach's not able to release enough hydrochloric acid, then your stomach can't kill off the bad guys as they work their way into your system. So we want to make sure that your stomach can do its job properly. Now, as we age, all of us are going to lose the ability to release hydrochloric acid properly. It just starts to slow down. That's why you typically see more gastrointestinal disorders in the elderly than you see in our teenagers, those in their 20s and those in their 30s. If you add in the fact that many autoimmune patients also are having an autoimmune attack onto those parietal cells in the stomach, it's going to be very, very difficult for their gastrointestinal system to ever work properly. Just last week, I had a gal reach out to me. She has one bowel movement every 4 to 10 days. Guess what one of the markers I'm ordering on her? Her parietal cell antibodies. So if she can't break her foods down, those foods get pushed into the gastrointestinal tract, and then we see chronic constipation in some of these patients. So you can have bloatiness, gassiness, diarrhea, constipation. You can have a weakened immune system. You can always be getting these infections due to having an autoimmune attack onto your parietal cells. How do we counteract that? It's rather simple. We take some hydrochloric acid, we take some digestive enzymes. Now, how do you know if this is happening? You can order that parietal cell antibody through blood work. Through my co-op, it costs about $33. Very inexpensive to get a very important piece of your health puzzle. All right, that is your 5-Minute Friday video. We'll see you on the next one.